This video is on another serious topic, crisis prevention and management planning. Consider escalating behavior problems as a symptom and not a disorder in themselves. So if somebody's escalated to that point that they need to have crisis intervention, it's not part of a disorder. It's not the disorder in itself. It's a symptom of the disorder. Escalating behavior problems that build up to a crisis may be the best or only way the person can communicate a need, and that something is wrong. Understanding what is underlying the behavior problem is the key to preventing and managing these problems. When a person has already experienced a behavioral crisis and there is a risk of recurrence, debrief and develop a crisis prevention and management plan. So 1, debrief. After the crisis, with the patient, caregivers, and team, identify what may have contributed to or caused the crisis, and which interventions used were effective or ineffective. Make recommendations regarding preventing and managing possible future crises. Identify and treat underlying conditions that cause or contribute to the crisis behaviors. Review medications, particularly psychotropics, and any medication changes made in the emergency department. So number 2 would be develop a crisis or prevention and management plan. A case manager or behavioral analyst is often the most appropriate person to coordinate the care planning meeting and to take the lead in developing the crisis prevention management planning. In Tennessee, an adult with an intellectual disability should qualify for TEN care and have access to services from a behavioral analyst. Eligibility for case manager or behavioral analyst services may vary in other states. Other options might include seeking assistance from a local mental health center or a mobile crisis team. The mobile crisis team here in Bangor, Maine, is community health and counseling services. Meeting as a team with the patient, appropriate caregivers, and interdisciplinary team. If indicated, include emergency services. So that would mean like the police, ambulance services, and stuff like that if included. Inclusion of the patient and caregivers in development of the plan will help to promote consistency in responses to escalating behavior problems and will help provide a shared way to document stages of escalation for treatment and evaluation. In the first column of the crisis prevention and management form, you want to identify the patient's behaviors. The patient behavior looks at each stage. Identify signs of escalating stage B, stage C. Early identification of signs of anxiety and agitation provides opportunities for interventions to keep the patient and others safe, and if possible, to prevent the situation from reaching a crisis. In the second column of the crisis prevention and management form, identify usually successful de-escalation or intervention strategies that caregivers can use. Include when to use them, for how long, how often, and where to record them. Clearly identify when to administer as needed medication. Clearly identify the circumstances under which the patient should be taken to the emergency department, and identify the care provided must be responsible for regularly reviewing and updating the crisis prevention and management plan. Develop a schedule with the patient and caregivers from all the environments for a regular patient-centered review of the individual and his or her needs, the behavior problems, the escalation continuum, and the corresponding interventions. Now, most people, when they go in for a mental health services, the provider will talk, and I've done this many times, about supports and what helps you so that they know and when to do it and stuff like this. And that's great. It's great for them to have, but I believe you should have a copy for yourself too. And even if you don't receive mental health services, there's a lot of forms online where you can be like, okay, crisis management, and fill it out for yourself. This can actually help yourself from reaching that crisis stage.